signs of poor circulation, and the best tea to reduce varicose veins. So that's going to be our topic for today. We'll discuss clinical signs of poor circulation, and I'll share a tea recipe with you that'll help improve your circulation and as a result, reduce varicose veins, especially those located in the legs, folks. This topic is incredibly important. Please comment where you're watching from and if you have circulation issues. So let me know in the chat or comments where you're watching from. And if you have circulation problems, if this is your first time watching me, or if you're part of the majority who watch but aren't subscribed, hit the subscribe button below, turn on notifications, and join Dr. João's channel family for guaranteed better health. Why? If you watch our videos and follow our advice, it's a sure thing. Your quality of life and health will definitely improve. So hit that subscribe button below and welcome to Dr. João's channel. João. The 12th sign of poor circulation is actually a symptom. There's a difference between signs and symptoms. We often use them as synonyms, but they're not the same. A sign is something we can observe. For example, a skin spot is a sign. A fever is also a sign. It's not just what we see, but what we can measure. What we measure is a sign. High blood pressure is a sign. So that's what a sign is. Now, a symptom is what we feel. Pain, discomfort, burning, or itching are symptoms. Those are symptoms. So the 12th symptom is pain. Pain affects most patients with poor circulation. Those with poor circulation often experience pain. Why? If oxygen or nutrients don't reach an area, that area will feel pain. With poor venous circulation, one might feel heaviness or general fatigue in the legs. In poor arterial circulation, we often refer to it as intermittent claudication, which is pain that occurs when a person walks a certain distance and then feels intense pain, especially in the calf. This pain is due to the lack of oxygen and nutrients reaching the muscle tissue. Poor arterial circulation can cause this intermittent claudication pain and also pain in muscle groups like glutes, calves, thighs, and legs due to lack of oxygen for proper muscle contraction. The 11th sign is swelling, which we technically call edema. So swelling in the lower limbs can be caused by venous, lymphatic, cardiac, or kidney issues. This swelling, especially in the afternoon, is common in people with poor circulation or venous insufficiency. The 10th sign is tortuous, dilated veins, varicose veins, which can cause spots, eczema, itching, and skin changes. The 9th sign is ulcers and sores. Wounds are usually acute injuries that heal within a few weeks. Ulcers are chronic wounds lasting months or years, common in various circulatory problems. The type of ulcer is determined by its shape, location, and other characteristics. The 8th sign is a change in skin color. When we have an arterial obstruction, for example, this can cause pallor, making the skin appear whiter because blood isn't reaching the area. This color change may be accompanied by cyanosis, a bluish or purplish tint, or hyperemia, which is it can also be hyperemia, which is when the skin turns red, or it could be gangrene, where the skin becomes blackened, or what we call Raynaud's phenomenon, which is essentially a triggered arterial vasospasm, usually caused by cold or stress. So when it's cold or they're stressed, a person might look at their hand and see 1 or 2 blue fingers. This is Raynaud's phenomenon. The 7th sign is a change in temperature. If someone has poor circulation, they may experience temperature fluctuations in different areas. So there will be colder areas and warmer areas. A cooler area indicates poor circulation, showing blood isn't reaching it. A warmer area might signal infection like erysipelas, common in circulatory issues. This temperature change can occur in the same limb or leg. Parts of one leg may have different temps or differ from the other leg. One leg feels normal while the other is much warmer or cooler. The 6th sign is thinning leg hair, common in advanced venous insufficiency. What happens? With circulation issues, blood can't properly nourish the area, so that area becomes deprived of oxygen and nutrients. impairing its normal functions. A person with less leg hair and baldness around the ankles may have circulatory issues. Lack of oxygen and nutrients to hair follicles can hinder hair growth in those areas. The fifth sign is a change in nail growth speed. An arterial blockage in one leg can cause slower nail growth compared to the other leg. So if a patient comes to us and says, "Doctor, it's odd. The nail on my left leg grows normally, but the nail on my right leg is always weak, always brittle, and doesn't grow at all." So this suggests that in the right leg where the nail isn't growing, there might be reduced oxygen and nutrient flow due to an arterial blockage. The frequency of nail trimming can also indicate poor circulation. The fourth sign is muscle atrophy. This means reduced muscle volume and strength as blood doesn't reach the area properly, especially in the legs. The third symptom is paresthesia or tingling sensations. These tingling feelings in extremities can be due to neurological or circulatory issues. In diabetes, for instance, there might be damage to the vasa nervorum, which are the small vessels that supply blood to nerves, leading to nerve death, and as a result, causing tingling and numbness due to the nerve damage. Arterial blockages can also cause tingling and numbness. Do you experience numbness? Do you have paresthesia? Do you feel tingling in your hands and feet? Let me know in the chat or comments. This could be a sign of poor circulation. Now, folks, for the last two signs before the tea recipe, I'd like to ask you to share this video, send it to others, and give it a thumbs up. When you like the video and show your support, you're helping more people gain access to this valuable information. So if you're ready to learn the final two signs of poor circulation that I've selected for you, and also the tea recipe that helps fight varicose veins, please like this video, give it a thumbs up, and share it with someone you love and want to see healthy. This video has the potential to change someone's life for the better. Your life could be what someone needs to discover they have poor circulation, and once they know, they'll seek help. So consider the power and potential your like has today, what your share means today, what your comment can do today to literally, without exaggeration, save a life, because circulatory problems are the leading cause of death nowadays. So come on, folks, let's like this video, comment, interact here on the live stream, and share to spread this positive message that will bring health to people, making it go viral. Let's make good things go viral, okay? The second sign, or rather symptom, is amaurosis fugax. Doctor, what's that? What's amaurosis fugax, this strange name? It's temporary blindness in one eye, where a person loses sight for a while, then it returns. They suddenly lose vision, but it comes back later. This is usually a vascular issue. A carotid plaque breaks off and blocks the retinal artery, causing temporary blindness. Then the plaque dislodges, moving away from where it was obstructing blood flow, and the person's vision returns to normal. Those with amaurosis fugax need caution, as it indicates higher stroke risk in the near future. If you've suddenly lost vision that later returned, be aware. It may mean you're at high risk for a stroke. And the first sign here is what we call blue toe syndrome. So the blue finger that's fixed there indicates ischemia. Ischemia is the interruption of blood flow causing oxygen deprivation. This blue finger syndrome can also be caused by an atherosclerosis plaque detaching and blocking blood flow in the finger artery. Those are the 12 signs and symptoms of poor circulation. Remember, folks, poor circulation is mostly caused by your habits. In a bit, after the tea recipe, I'll discuss how to address the causes of poor circulation. Tea helps, of course, but it's not a cure-all on its own. How do we make this tea? Take a liter of water and bring it to a boil. Then add 30 grams of horse chestnut leaf extract, about 1.5 spoonfuls. Add a tablespoon of green tea and let it steep for 10 minutes. Then strain the tea and drink 2 to 3 cups daily. Be careful not to drink it close to bedtime, as green tea contains caffeine, okay? If you're taking a coumarin anticoagulant like Maravan or warfarin, be cautious too, all right? You might not be able to use this tea, so talk to your doctor first, got it? So that's the tea recipe. These issues are directly linked to your lifestyle, habits, and behaviors. If you don't change these, the problem will persist. Is this message clear to everyone? Lifestyle is the key to quitting medications and avoiding most diseases. So Lifestyle prevents, treats, and reverses diseases. If you want to treat poor circulation, high blood pressure, diabetes, high cholesterol, insomnia, anxiety, depression, and other conditions, I'll teach you how to have a healthy lifestyle naturally without doctors, tests, or medications to prevent, treat, and reverse diseases. I teach this in my book, The Longevity Code, which you can get by clicking the first link in the description or the pinned comment.